Normal? Okay. Now today I will talk about the larynx. All are you knowing about the respiratory tract? Respiratory tract, we divide the respiratory tract into two parts, upper half of the respiratory tract and lower half of the respiratory tract. Upper half of the respiratory tract include nasal cavity, nasopharynx, and below that, so up to the part of nasopharynx, and this we are taking this upper part of respiratory tract. Lower part of respiratory tract include larynx. I am seeing the trachea person. You, yes, I am telling you. You are looking me. Lower part of respiratory tract includes larynx, trachea, lungs. In lungs, including the bronchial tree, bronchi, and alveolar ducts. Now the part is this, that larynx is the upper expanded part of lower respiratory tract. It is upper expanded part of lower respiratory tract. The purpose of dilatation or expansion of the upper part is that this is used for the production of the sound and also used for the phonation. Beside that, respiration, girl, chupchap, yes. So that part, so what is the larynx? Larynx is the upper expanded part of lower respiratory tract, and this upper expanded part of lower respiratory tract doing the function of production of the sound, and this is called phonation. So first function of larynx is phonation. Second, it also includes respiration. Then it is also helpful in protection. And lastly, it also helps in deglutition. Deglutition is swallowing. When we swallow the food, that food is passing downwards by the movement of deglutition. So all these are the function of larynx. पहली बार आ रहे हो क्या? Hurry up! Sit down. So the larynx, which is having the following functions. When we see the larynx, it is a fibrocartilaginous framework. I am using the word fibrocartilaginous framework, and this fibrocartilaginous framework is remain patent. If there is slight disturbance in the patency of the fibrocartilaginous framework, it will result into stop respiration, or person can die without he or she cannot inhale the air. So by seeing these functions, the framework of larynx is kept patent. Now see the structure of the framework. This framework of larynx is consisting of number of cartilages, and all these cartilages, they are interconnected with each other by means of ligaments, fibrous membrane, and the movements of these, all these cartilages are because of number of the muscles. So all these structures, cartilages, ligaments, fibrous membrane and the muscles, all are forming the framework of larynx. These cartilages, they are 9 in number. There are 9 cartilages, and some cartilages are unpaired and remaining are paired cartilages. There are 2 types of cartilages, paired cartilages and unpaired cartilages. The unpaired cartilages, that are thyroid cartilage, cricoid cartilage and epiglottis. That means these cartilages are single in number. As you can see, thyroid cartilage, single, not paired. Cricoid cartilage, below that, that is also single, singlet ring shape, and epiglottis, that is leaf shape, also single in number. So what we say, that unpaired cartilages, these are 3. Then the paired cartilages. The paired cartilages are, look, these are the thyroid cartilage, and these are the corniculate cartilage. You can see this one. Then the part paired cartilages are arytenoid cartilage, this one, and the parts are other cricoid cartilage, arytenoid cartilage, cuneiform cartilage and corniculate cartilage. These cartilages are very smaller in size and they are paired. So these cartilages are 9 in number, and their ligaments and the muscles I will talk just after seeing this. First of all, see this diagram. This is the nasal cavity, nasopharynx and the oropharynx, and this is the part of tongue, and look down, uvula, and this is the epiglottis. And this is the part of laryngeal cavity, and this is the part of esophagus. So if we see the position of the larynx, larynx is present in the anterior midline. It is present in the anterior midline, extending from root of tongue to the part of cricoid cartilage, and it is lying, see the diagram, it is lying anterior to the laryngopharynx. Okay, this is the part of laryngopharynx, so it is lying anterior to this part, and at the same time it is corresponding to the cervical cartilages from C3 to C6 cervical cartilage. C3 to C6 cervical cartilage. After knowing the position of the larynx, if we see, or you can notice this point, the voice of male are loud and they are low pitch. Understand? While the voice of children and female are high pitched and low. बहुत इंटेलिजेंट हो ना, खड़े हो जाओ, गेट अप, आउट, आउट, don't repeat this. So, you have seen the difference of male voice and female voice. The female voice are high pitched and low in sound. Same in the children. This difference is result after the puberty. Up to the puberty, the voice are same, both in male and female. After the puberty, the voice is different. The reason for that, the thyroid cartilage, there is rapid growth of thyroid cartilage in male, and due to this high growth of the thyroid cartilage, which is consisting of two lamina, and these lamina are fused in the midline, and due to rapid growth of this part of thyroid cartilage, this fusion of the two lamina of the thyroid cartilage is called Adam's apple. That is called Adam's apple. So Adam's apple is seen after the puberty, and that is responsible for the low pitch and loud sound of the male. All right. You can revise your previous part. Look here, nasal cavity, nasopharynx, oropharynx, and this is the laryngopharynx, and this is the part of laryngeal cartilage. One thing clear by this diagram. Look here, this is the epiglottis. The epiglottis is directed downward and backward. Look here. So it is forming the laryngeal inlet. So this is the laryngeal inlet, and the laryngeal inlet, the upper boundary of the laryngeal inlet is formed by the epiglottis. So this epiglottis, it prevents the entry of foreign, whether the liquid, fluid, or the particles or food. It prevents the entry of food or fluid into the larynx. Now I will talk one by one each cartilages. First of all, thyroid cartilage. Thyroid cartilage consisting of two lamina. This is the one lamina of the thyroid cartilage, and see this diagram. The two lamina of the thyroid cartilage, they are fused in the midline and forming the thyroid angle. The thyroid angle, some teachers ask, what is the thyroid angle in male and female? I never asked. It is 90 degree in the male and about 120 degree in female. Obtuse and more. All right. The important thing, the thyroid lamina, they are quadrilateral in shape. Look this diagram. They are quadrilateral in shape, and their posterior border, this one, is projecting upward and downward. This projection is called superior cornu and inferior cornu of the thyroid cartilage. Okay. Now this thyroid cartilage is very important. It is giving the number of the muscles, ligaments, and all that. Look this part. This is the epiglottis. On the posterior border of the thyroid cartilage, these three muscles are attached. Starting from above, palatopharyngeus. That means muscle connecting the two things, palate and pharynx. Palatopharyngeus, and downward there the salpingopharyngeus, and more downward stylopharyngeus. So these three muscles, they are attached on the posterior border of the thyroid cartilage. Then the outer surface of the lamina, there is oblique line. If you see the thyroid cartilage, you will see still very clearly. Oblique line is present on the external surface of thyroid lamina, and this oblique line is giving attachment from above to downwards the part of thyroid muscle and downward the thyropharyngeus muscle. That is the part of which constrictor? Inferior constrictor. Good. That is the part of inferior constrictor muscle of the pharynx. That is attached to the lower part, and in middle there you can see the interrupted line. That is the part of sternohyoid muscle. Look, the two muscles, thyroid and the thyropharyngeus, are shown in the pink color. They are taking the origin from the thyroid cartilage, and the middle one shown by the interrupted line, sternothyroid, that is insertion of the sternothyroid muscle. The upper two muscles which are taking origin, they lift the thyroid cartilage or helps in elevation of the thyroid cartilage, while the sternothyroid muscle, that is depress the part of thyroid cartilage. The posterior surface of thyroid cartilage, see this diagram. In the midline, it is giving attachment. One, look here, this is the epiglottis. The lower end of the epiglottis is narrow and is stalk, while the upper end of the epiglottis is dilated and expanded. This upper end of the epiglottis is forming the boundary, upper boundary of the inlet of the larynx. Okay, but the lower narrow end, that is called stalk. The stalk of epiglottis is attached to the posterior surface of thyroid cartilage by the ligament that is called thyroepiglottic ligament. This one. This is the thyroepiglottic ligament. Downward to the thyroepiglottic ligament, there is another ligament, and that ligament is the buccal ligament. And just lateral to the buccal ligaments, you can see the pink color muscles, and these pink color muscles are buccalis muscle and the thyroarytenoid muscle. All these structures, they are attached to the posterior surface of thyroid cartilage, and commonly asked, what are the structures attached to the posterior surface of thyroid cartilage? So this diagram will helpful. Understand? Thyroepiglottic ligament, buccal ligament, and the muscles, buccalis muscles and the thyroarytenoid muscles. And look downward, see this diagram again. Lower down, this is the inferior corner of the thyroid cartilage, which are connected with the lateral surface of the cricoid cartilage. This is the cricoid cartilage. And on the posterior surface of the cricoid cartilage, I am telling you this because at present you can see the diagram. On the posterior surface of the cricoid cartilage, there is attached the tendon of the esophagus on the middle, and on each side there is attachment of the posterior cricoarytenoid muscle, very important muscle. If this muscle is failed, the person can die. That I will tell you later on. And another, look this diagram. This is the thyroid cartilage, and downward this is the cricoid cartilage. Between the thyroid cartilage and cricoid cartilage, there is another muscle, that is cricoid muscle, the cricothyroid muscle. And below the cricoid cartilage, these are the part of the where you find the cartilages, T-shaped cartilage, multiple in number. क्या देख रहे हो आप लोग? कैडावर का डिसेक्शन देखा? ट्रेकिया में क्या होते हैं? कार्टिलेजेस होती नहीं होती? तो यही तो पूछ रहा हूँ आपसे. Where you find the cartilages, large number of the cartilages in front of the trachea, tracheal cartilages. So look here, this is the cricoid cartilage. Downward you can see the first tracheal ring. This first tracheal ring is connected with the cricoid cartilage by this ligament, that is cricotracheal ligament. After seeing this, Look this part, tongue. Any doubt? Anterior two-third part of the tongue. What is its nerve supply, sensory nerve supply? I am not asking taste sensation. Lingual, general sensory lingual, and taste sensation by chorda tympani. And posterior one-third part of tongue, that is including both taste as well as general sensation. Okay. And just look here, this is the epiglottis. This is the epiglottis. The epiglottis is connected with the posterior surface of the tongue. Try to understand. You will not find this epiglottis, anterior surface of the epiglottis is connected to the posterior surface of the tongue by this ligament. This is called median glossoepiglottic ligament. Median glossoepiglottic ligament, and just this median glossoepiglottic ligament or the ligament which is connecting the posterior surface, dear समझ लो एग्जाम में कुछ नहीं कर पाओगे. आपसे कह रहा हूं थर्ड रो लास्ट में, डोंट टर्न योर फेस. The anterior surface of the tongue, the posterior surface of the tongue is connected with the epiglottis anterior surface by this glossoepiglottic ligament. This glossoepiglottic ligament is dividing into the lateral part and medial part. So medial part is called median glossoepiglottic ligament, lateral is called lateral glossoepiglottic ligament, and between these you can see the space that is called vallicula. You will come across the vallicula repeatedly, and by that time you forget where you find the vallicula. Because of that I am showing you this diagram. So vallicula is present between the median glossoepiglottic ligament and the lateral glossoepiglottic ligament. The food particles and in the children's, the pin and everything located here in the vallicula. So before taking out that, you must be clear about that where you have to search. First of all, see in the vallicula. जब पता ही नहीं है तो फिर कहाँ ढूंढोगे? Okay. So first of all, any foreign particles that is lodged first in the vallicula. After seeing in the vallicula, then you descend downward. Now see the various ligaments in the thyroid cartilage. This is the thyroid cartilage, this is the head bone, and this is the epiglottis. The thyroid cartilage is showing the number of the ligaments and membrane. This is the thyroid membrane, that is the membrane present between upper border of the thyroid cartilage and lower upper border of the head bone. No doubt it is shown here in the lower border of the head bone, but it is border of the head bone. And this thyroid membrane, it is pierced by structures. What are those structures? Yes, the thyroid membrane is pierced by branches of recurrent laryngeal nerve, that is internal laryngeal nerve, and also the superior laryngeal vessels. So thyroid membrane, you can see here, it is pierced by the superior laryngeal vessels and internal laryngeal nerve, very common and commonly asked. After this, another important thing, that look here, there is thickening of the thyroid membrane in the middle and also in the lateral side. This thickening of the thyroid membrane in the midline is called median thyroid ligament, and laterally it is called lateral thyroid ligament. Understand? सीधे बैठ जाओ, सोना पीछे जाके सो जाओ. Sit properly. So The thickening in the middle part, that is called median thyroid ligament, and thickening on the lateral part is called lateral thyroid ligament. So what are these ligaments? These are thickening of the thyroid membrane. See the lateral thyroid ligament. In lateral thyroid ligament, you can see the small nodules. This one. These are the cartilago-tritico. Cartilago-tritico, that are the thickening nodules present in lateral thyroid ligament. Look downward. This is the corniculate cartilage below the thyroid cartilage, and this is the inferior horn of the thyroid cartilage. This is the superior horn of the thyroid cartilage. The lower border of thyroid cartilage is connected with the cricoid cartilage by the another ligament, and that ligament is called, in between the two, cricothyroid ligament. Understand? This is the cricothyroid ligament. लिख लो मैडम, किताब में तो रहेगा, चेक कर लेना कभी भी, लिखा करो, डेवलप द हैबिट. So these are the ligaments of the thyroid cartilage. On the posterior surface of thyroid cartilage. Okay, before that I first tell you about the corniculate cartilage, then you can understand. Look this diagram. This is a cricoid cartilage and this is the thyroid cartilage. At present, just understand this. The thyroid cartilage is connected with the cricoid cartilage, and the shape of the cricoid cartilage in the first diagram I have shown you. It is a single cartilage, and this single cartilage is signet ring shape, and the signet ring shape means that anterior arch of the thyroid cartilage is narrow, while the posterior part arch of the thyroid cartilage is larger. And this cartilage, इसको करो यार, पीछे करो जल्दी से, रुको एक मिनट. Look this diagram. This is the cricoid cartilage, and this cricoid cartilage, खड़ी रहो वहीं पे. This cricoid cartilage is signet ring shape, and it is articulating above with the thyroid cartilage, and the ligament, that is the cricothyroid ligament, and below it is articulating with the part of trachea, first ring of the trachea. The posterior surface of this is articulating with the another cartilage, and look here, this is the arytenoid cartilage, pyramidal in shape. I will not show you again. Look at present. This is the pyramidal shape, the arytenoid cartilage, that is also the part of paired cartilages, and the another one, the corniculate and cuneiform cartilage, that are the nodules. This is the posterior part we have discussed. Now look this part. This is the cricoid cartilage. The lower border of the thyroid cartilage, is articulate with the part of the upper or posterior lamina of the cricoid cartilage. This is the cricoid cartilage. So posterior arch of the cricoid cartilage is larger, that is called lamina, that is articulating above with the inferior border of the thyroid cartilage, and lower down it is articulating with the part of first tracheal ring. Now the important thing, that posterior surface of the part of cartilage, thyroid cartilage, you can see pyramidal shape, two structures you are seeing here. I am talking of this diagram. This is the posterior surface of thyroid cartilage. This is the posterior surface of the cricoid cartilage. On posterior surface of the thyroid cartilage, you are seeing the pyramidal shape, two structures. These are the arytenoid cartilage. And just above the arytenoid cartilage, you are seeing the nodule. That is the part of cuneiform cartilage. And above the cuneiform cartilage, again the small nodule. That is the part of corniculate cartilage. So all these three, they are the paired cartilage. Arytenoid cartilage paired. Above that, corniculate cartilage paired and the cuneiform cartilage paired. So total number is how much? 6 and single are 3. So total number is 9. Now we see again this pyramidal shape arytenoid cartilage. Their lower border is articulating with the upper surface of the cricoid cartilage. Okay. Now see this diagram. That's all. This is the cricoid cartilage. This is the inferior border of the thyroid cartilage, and here shown the arytenoid cartilage. Above that is small cartilage. All these cartilages, as previously I used the word, they are interconnected with each other by the ligaments. So the ligaments, see the ligaments, what are the ligaments which are connecting this? The inferior cornu of the thyroid cartilage connected with the side of the cricoid cartilage, and this is connecting by the ligament cricothyroid joint. So joint form, this is named as cricothyroid joint. The second joint, look here, the inferior surface of arytenoid cartilage. This is the shown the arytenoid cartilage pyramidal shape. The inferior surface of arytenoid cartilage articulating with the upper lamina of the cricoid cartilage, and this joint is called the cricoarytenoid joint. Between the two bones, two cartilages, that are the cricoid cartilage and arytenoid cartilage. So this joint is called cricoarytenoid joint. The apex of the arytenoid cartilage is articulating with the small nodule, and that nodule is the corniculate cartilage. So this is joint is the arytenoid corniculate joint. So these are the important joints of this larynx. See this diagram, you can understand the various ligaments of the joint. This is the hyoid bone and this is the epiglottis. The ligament present between the hyoid bone and epiglottis, that is called hyoepiglottic ligament. This is hyoepiglottic ligament, and look downward. This is the hyoid bone and this is the thyroid cartilage. So between them, which type of ligament is this? Thyroid, and this is the thyroid membrane. Now look here, this is the epiglottis. As I told you, epiglottis, lower end of the epiglottis is stalk, and this stalk of epiglottis is connected to the posterior surface of thyroid cartilage by the ligament thyroepiglottic ligament. Come downward. This is the thyroid cartilage, lower end of the thyroid cartilage, and it is connecting with the cricoid cartilage, and that ligament is the thyrocricoid ligament. After seeing this, some ligaments, they are present interiorly, and these are the buccal ligaments and vestibular ligaments. Buccal ligaments and vestibular ligaments, and another membrane. Before talking that, I want to show you this diagram. Look here. रुको, इसको करो enlarge करो. Look this part. The arytenoid cartilage which is piriform in shape. It is having the apex, this one. This is the apex, and this is the part base of the arytenoid cartilage. See any diagram? I am talking of this part. So this is having the two parts, apex and base. Base is dividing into two parts. The part of the base which is present anteriorly and the part which is present laterally. So the part which is present laterally outward, that is called muscular process, and anteriorly, that is called buccal process. So I will talk these two important things, buccal process and muscular process of the arytenoid cartilage. The one important muscle which is present outside, and it is lying between the two cartilages, lower down the cricoid cartilage, above the lower part of the inferior border of the thyroid cartilage, and this is the inferior cornu of the thyroid cartilage. This is the cricothyroid muscle. The cricothyroid muscle is present outside, and its nerve supply is also different. That is external laryngeal nerve. That is external laryngeal nerve. Underline that. Only this muscle is supplied by the external laryngeal nerve of the larynx. Now look here, the ligaments, I have told you, the ligaments which are present outside, these are called the extrinsic ligaments, and now see the intrinsic ligaments which are present inside the larynx, and these are, the one is the thyroepiglottic ligament, you can see here, and it is related with the muscle thyroepiglotticus muscle. So you can see here the thyroepiglottic muscles and small part of the thyroepiglottic ligament. Another is between the arytenoid cartilage and the epiglottis, that is aryepiglottis muscle. And as I told you, this is the arytenoid cartilage. Look here, this buccal process of the arytenoid cartilage, and this is the muscular process of the arytenoid cartilage. From the anterior surface of arytenoid cartilage, you can see this part. So one arytenoid cartilage on this side, another arytenoid cartilage on this side. Both the arytenoid cartilages, they are connected with each other by the transverse arytenoid ligaments and muscles. So transverse arytenoid muscle. What is the problem here? करना इसको मसल्स का कर दो, मसल्स पे कर दो, मसल्स, सारी मसल्स, और आगे चलो, बस इस पे आओ. This diagram is showing all the muscles, intrinsic muscles of the larynx. Extrinsic muscles we have discussed, cricothyroid and the attached to the posterior border of the thyroid cartilage and lamina of the thyroid cartilage. All those are the extrinsic muscles, and these are the intrinsic muscles of the larynx. This is the arytenoid cartilage, muscular process. It is giving attachment to the thyroarytenoid muscles. This one, thyrocricoid, and the lateral cricoarytenoid muscles, and the above, the aryepiglotticus muscle. Now look this diagram. These are the two important muscles, aryepiglottics and lower part of the oblique arytenoid muscle. Look this diagram, because I will use this. This is the epiglottis, and this is the two arytenoid cartilage. The two arytenoid cartilage, they are articulating with this muscle that is called transverse arytenoid muscle, this one. And from the side of the epiglottis, a muscle which is coming from the arytenoid cartilage, muscular process of the arytenoid cartilage, this one, which is going to the side of the epiglottis. This is called aryepiglotticus muscle. The lower part of aryepiglottis muscle, that is called oblique arytenoid muscles. These are the two muscles which are closing the inlet of the larynx. Because of that, that is important. Aryepiglottis muscle and oblique aryepiglottis muscle. These are the muscles which are closing the inlet of the larynx. The lateral cricoarytenoid, which is connecting, present on the lateral side, and posterior to the cricoid cartilage, these are the posterior cricoarytenoid muscles. After seeing these, there are number of the muscles. We classify the intrinsic muscles according to their functions. The muscles which are closing the inlet of larynx, these are oblique arytenoid and aryepiglottis muscles. These are the two muscles which are closing the inlet of larynx, and open the inlet of larynx, thyroepiglottic muscles. So thyroepiglottic muscles open the inlet of larynx. Then the muscles which are responsible for abduction of the vocal cords. Abduction of the vocal cords. There is only one muscle which is abduct the vocal cords, posterior cricoarytenoid, underline that. That is also called the safety muscles of the larynx. The remaining all the muscles, they are adductor of the vocal cords. When the vocal cords are adducted, person cannot inspire the air. Neither any foreign particles can pass. लेकिन जब जिंदा ही नहीं रहेगा तो क्या मतलब? Understand? No air can enter. So besides the posterior cricoarytenoid, all the muscles of intrinsic muscles of the larynx are adductor of the vocal cords. The muscle, intrinsic muscle, which is responsible for tensing the vocal cords. That means on their contraction, they increase or tensioning the vocal cords, and it is useful in the singers. It is useful in the singers. Slightly paralysis or the effect of the cricothyroid muscle will alter the voice of singers. So they are very conscious about this. Cricothyroid muscle. This is the muscle which is tensioning the vocal cords. And another is vocalist muscle, which is also responsible for tensioning the vocal cords. So tension of the vocal cords is done by the two muscles. One is the cricothyroid, another is vocalist. Now see this part. Now we are in position to understand this. On the posterior surface of the thyroid cartilage, you are seeing this purple color picture, which is attached through the lateral side of the epiglottis, whole of the lateral side of the epiglottis, and also the posterior surface of the thyroid cartilage, and posteriorly it is attached to the two arytenoid cartilage. Posteriorly it is attached to the two arytenoid cartilage. इसकी बात कर रहा हूँ, इस पिंक कलर के स्ट्रक्चर को देखिए. It is attached to the lateral side of the epiglottis completely, also to the posterior surface of the thyroid cartilage, and posteriorly it is attached to the both the arytenoid cartilage, and above them they are attached with the corniculate and cuneiform cartilage. This is called the quadrangular membrane. Quadrangular membrane. So what is the quadrangular membrane? It is the fibroelastic membrane which is attached to the posterior surface of the thyroid cartilage and completely side of the epiglottis and posteriorly this. Now see the lower border of the quadrangular membrane. this one. This lower border of the quadrangular membrane is thickened and consisting of elastic fibers or elastic tissue. This is called the vestibular ligament. Look here. So what is the vestibular ligament? Vestibular ligament is thickening of the lower border of quadrangular membrane, and it is consisting of elastic tissue. After seeing this, now see this part. This is the cricoid cartilage, and this is the lower border of the thyroid cartilage, and this is the cricothyroid ligament, green color. So from the posterior border of the thyroid cartilage, a membrane is attached, and posteriorly it is attached along the complete arch of the cricoid cartilage. That is this one. This is called cricobuccal membrane. Cricobuccal membrane. This cricobuccal membrane, अभी एक को तो समझाया मैंने, इसको बाद में समझ लेना. मैं एक ही किताब कंसिडर नहीं करता हूँ मैडम, और सारी किताबें नोट कर लो. बोलूं? तो why don't you understand when you are sitting in the class? Look this. This is the cricobuccal membrane. This cricobuccal membrane, look the upper border of the cricobuccal membrane. ये दिख रही है आपको? This upper border of the cricobuccal membrane is again thick, and this thickened part of upper border membrane, that is called the buccal ligament. So what is the buccal ligament? Buccal ligament is thickening of the upper border of cricobuccal membrane. So we know the two ligaments. One is the vestibular ligament, another is the buccal ligament. Now the difference between the two, the vestibular ligament is consisting of elastic tissue, where the buccal ligament is consisting of yellow elastic tissue. Underline that, yellow elastic tissue, and that is the purpose. By the vibration of vocal cords, sound are produced. The sound is produced by the vibration of the vocal cords, and the vocal cords are consisting of yellow elastic tissue. Sound is not produced by the vibration of vestibular ligaments. Okay? It is produced by the vibration of the vocal cords. बैठ जाओ, ये चेयर ले लो, नहीं वहीं बैठे रहो. So after knowing this, and look here, the vocalis muscle is this one. That is the thickening part between the two parts. Arytenoid vocal process of this arytenoid cartilage is this one. Now I come to the part before this. See this diagram. The whole of the laryngeal cavity or interior of the larynx is dividing into three parts. Interior of the larynx is dividing into the three parts, and this division is done by the two ligaments, pair of the two ligaments. What are those? Vestibular ligaments and vocal ligaments. See this. This is the vestibular ligament. Okay, and this is the vocal ligaments. So by the two pairs of vestibular ligaments and vocal ligaments, we divide this interior of laryngeal cavity into three parts. The part of the laryngeal cavity above the vestibular ligament, that is this part A, that is called vestibule or supraglottic part. Vestibule or the supraglottic part. The part of the, the lower part, that is the part of laryngeal cavity between the vocal ligaments and below the cricoid cartilage, lower border of the cricoid cartilage, C, that is the infraglottic part of the larynx. That is infraglottic part of larynx. And the third one, between the vestibular ligaments and the vocal ligaments, that is B part, that is the glottic part of the larynx, and this is also named as ventricle of the larynx. This is also called the ventricle of the larynx. This is very important because by understanding this, you can understand how the sound is produced and which part is more dangerous and all that. After knowing this, another thing which you have read, see the supraglottic part. On the lateral side of the supraglottic part, you are seeing the space, and that space is called piriform fossa. You have read in the pharynx, piriform fossa. Okay, I will come to that part. So, look here, the lateral boundary of it is formed by the thyroid membrane and the thyroid ligament and this, and the medially there is the airy epiglottic fold. Medially, the airy epiglottic fold. Which nerve is lying in this piriform fossa? Bolo. Which nerve is lying in piriform fossa? Because it is very important while doing the parathyroidectomy or any operation of the thyroid and this, we go approach through this piriform fossa, and in the piriform fossa there is present internal laryngeal nerve. After piercing the thyroid membrane, ये देखिए diagram. This is the thyroid membrane. I have told you the internal laryngeal nerve is supplying to the interior part of the larynx. So how it enters into the larynx? By piercing the first thyroid membrane. After piercing the thyroid membrane, it comes to the piriform fossa, then it comes here in the larynx. So during the partial thyroidectomy and this, you must keep this nerve in your mind, otherwise this nerve will be damaged. At the same time, the nerve supply of the larynx, the motor supply of the larynx is from both the internal as well as external laryngeal nerve, which are the branches of, I am telling you, the both external and internal laryngeal nerve are supplying to the motor supply to the larynx, and these internal and external laryngeal nerves are the branches of recurrent laryngeal nerve, vagus nerve. Okay, so motor supply of the larynx is by external and internal laryngeal nerve. The sensory nerve supply of the larynx, I am using the word sensory nerve supply of the larynx. Above the vocal cords, the sensory nerve supply of the larynx is by any one. I have told you very clearly while teaching you the vagus nerve. Sensory nerve supply of the larynx above the vocal cords is by internal laryngeal nerve, and below the vocal cords recurrent laryngeal nerve. Okay, तो अंडरलाइन कर दो अगर नहीं करा तो, अभी भी जवाब नहीं मिला मेरे को. The sensory nerve supply of the larynx above the vocal cords is by internal laryngeal nerve, and below the vocal cords by the recurrent laryngeal nerve. All right. The blood supply above the vocal cords is by the superior thyroid artery. That is the branch of laryngeal branch from the superior thyroid artery, and below the vocal cords the branch from the inferior thyroid artery. Lymphatics above the vocal cords pass into the deep cervical lymphatic nodes, and below the vocal cords to the deep cervical lymph nodes, inferior part. All right, these are very simple things. Now the important part, the larynx is very important and the every doctor should be perfect, because most commonly the children's and also the drunkard came to the doctor by the part of obstruction of the laryngeal inlet. The inlet of the larynx is boundary is formed by the above by the epiglottis. Epiglottis is projecting downward and backward. Okay. Before that, the one thing I want to make you clear is supraglottic part of the larynx, that is this one. Supraglottic part of larynx is very sensitive. It is very sensitive. So what happens? As the person take or drinking water or fluid, if some part of the water or the fluid if enters into the through the laryngeal inlet, where it will come first? In the supraglottic part. Okay, or any foreign particles, whether it is the liquid or the pieces of food, if they comes into the supraglottic part, the supraglottic part is very sensitive. So person starts very frequently very high coughing. Why? Because the supraglottic part is very sensitive. So as the foreign particles or the food enters into the supraglottic part, the person develops rapid coughing. The purpose of rapid coughing is to expel the foreign particles. That is the normal. But if there is a nerve injury, then the supraglottic part will lose its sensitiveness. So, in the nerve injury, it is lost the supraglottic part is sensitivity, and the sensitivity may be lost for very small or in case of the drunkard. So, loss of the sensitivity of the supraglottic part results into the entry of foreign particles into the glottic part here, and once it will comes here in the glottic part, it will result into obstruction of the air. The air cannot be enter, and that will result into asphyxia or the death. Look this diagram which I was telling you. This is the piriform fossa, this is the internal laryngeal nerve. This is the internal laryngeal nerve. So take precaution of the internal laryngeal nerve. And what is this part? This is the supraglottic part and this is the infraglottic part. Now look this part, glottic part. That is lying with it is a just antero-posterior cleft, just cleft-like structure, and this cleft-like structure is also called sinus of the larynx, sinus of the larynx or the glottis part. This glottic part or sinus of larynx on lateral side, it is showing the extension of the mucous membrane, and this extension on the side of the sinus of the larynx, this is called the saccule of the larynx. This saccule of the larynx, have you seen the trumpets? Trumpets देखे हैं आपने? आजकल शादियां बहुत हो रही है, देख लेना. The person who are using the trumpets, they have the enlargement of the swelling on the thyroid cartilage. उनके thyroid cartilage के साइड पे swelling दिखेगी. Or the person who are working in the glass blowers, the person who are doing the glass blower or the trumpets, the saccule of the larynx is enlarged. The saccule of the larynx is enlarged, and this saccule of the larynx is enlarged in the monkeys also. So what is the saccule of the larynx? And being a doctor, if someone asks you what it is, this is enlargement of the saccule of the larynx. And why it is enlarged? Because the high produced air is collected here. High production of the air is collected here in the saccule. That is called laryngosele. That is called laryngosele. That I will come just now. This one. This laryngosele, look here, it can be smaller in size. Once it is smaller in size, it will remain inside the larynx and we cannot see. But if it is enlarged, what it will do? It will pierce the thyroid membrane, and after piercing the thyroid membrane, it comes out. That is called external laryngosele. That is called external laryngosele. Before coming to this, if the external laryngeal nerve is injured, if the external laryngeal nerve is injured unilateral, the person will complain of some problem in the production of the sound. And naturally this person will complain will be either singer or teacher, not others. And what they will complain that sir कुछ आवाज कम हो रही है. If it is bilateral, if the nerve is external laryngeal nerve is bilaterally injured, definitely the more sound will be affected. This is because the external laryngeal nerve is paralyzed or injured, that will result into paralysis of the cricothyroid muscle, and cricothyroid muscle is responsible for tensioning the vocal cords. Understand? Besides this, if there is injury of recurrent laryngeal nerve on the one side, if there is a recurrent laryngeal nerve injury on one side, that will result into, what will be the effect? Recurrent laryngeal nerve injured हो गई तो क्या होगा? What will be the effect? Besides the cricothyroid muscles, all the muscles of the larynx are supplied by recurrent laryngeal nerve. So on the affected side, besides the posterior cricoarytenoid muscle, all the muscles of the larynx are adductor of the vocal cords, are the adductor of the vocal cords. So the person will again complain of the lower down of the voice, or the voice will be affected on one side, because there will be no more effect. The reason is the normal side vocal cords will move towards the affected side and they will balance. So person will either come to the doctor or not, or just neglect, slightly voice affect. But if the recurrent laryngeal nerve of both the sides are paralyzed, if the recurrent laryngeal nerve of both the sides will be paralyzed, so what will be the effect? All the muscles of the vocal cord, they will be paralyzed, and the person will definitely come to the doctors and say, sir, the voice production is affected, and also I am feeling the problem in taking respiration. The reason is the muscles of vocal cords, they are responsible for adduction of the vocal cords. Adduction of the vocal cords paralyzed हो गया, तो muscles will be present in the direction. Vocal cords का direction क्या होगा? देखिए, adductor muscles paralyzed, abductor muscles will work. So the vocal cords will be lying in between the adduction and abduction. that is called paramedian position. Listen again. When the both recurrent laryngeal nerve are paralyzed, in that condition, what happens that vocal cords present between the two positions, neither abducted nor adducted, and this position is resulting into the low production of the voice and also feeling problem in the taking inspiration. And this position is called paramedian position of the vocal cords. The third one, both the recurrent laryngeal nerve and external laryngeal nerve are paralyzed. In that case, the vocal cords are abducted and fixed. Vocal cords are abducted and fixed. Also paralysis of the adductor muscles, so the vocal cords cannot come normally. And this condition of the vocal cords is called cadaveric position of the vocal cords. So what happens in the cadaveric position of the vocal cords? The vocal cords are fixed in the abducted condition and they cannot be adducted. Vocal cords are fixed in the abducted conditions and this is called cadaveric position of the vocal cords. Naturally the person will die. After all this, I come to the part. If the person, generally the children and some drunkards, if they inhale the foreign particles, normally their coughing is there and they will expelled out. But if it is also failed and came to the emergency, then what the doctor will do? The doctor will expel out the foreign particles, not by putting the hand inside the mouth. Understand? That is the procedure is called Hilmeck position. Look this diagram. बहुत इतना ही है. This is the patient. The lady is the patient who have taken the inhale the foreign particles. See, the doctor is standing behind her and put his hands. Try to understand. Put his hands below the epigastrium, but the one hand should be in the fist form. One hand should be in the fist form. Another is that. So like that. And after putting this, the another thing is then the doctor pressing the fist backward and forward multiple repeatedly. By doing this, what happens? That whatever the inhale air, try to listen. ये पूछ सकता हूँ आप. What happens when we are doing this practice? That repeatedly we are doing this. The inhale air, जो air बची हुई है lungs के अंदर, that will expelled out. And as the air which is inhaled air from the lungs expelled, they will put forward the foreign particles or they expel the foreign particles. This is called the Heimlich method. After doing this, lastly, I am coming to the rheumatoglottids. So rheumatoglottids, what is the rheumatoglottids that I want to tell you? It is the space between the two vocal cords, and look here, these are the arytenoid cartilage and these are the ligaments, vocal ligaments and all that. So this space is called the rheumatoglottids. And rheumatoglottids, ये देखिए दोनों साइड पे क्या दिख रही है आपको? vocal ligaments. So this is the space between the two vocal ligaments, and this space is called the remaglottis. So what is the remaglottis? That is a slit-like space between the two vocal ligaments, and this space or remaglottis is dividing into two parts. Look, the upper two-third part is the green color, that is intramembranous part, and the lower part, which is the pink color, light pink color, that is called intracartilaginous part. This is not so important, just for your knowledge, but don't forget, because you are becoming doctor. Now look, the upper part, that is called intramembranous part, intracartilaginous part. So when the person is producing the sound, there is the movement of the vocal cords, and this movement of the vocal cords is variable. Look here, during the quiet respiration, the intramembranous part is just pentagonal in shape or triangular in shape. ये दिख रहा है आपको intramembranous part, and intracartilaginous part is very closed, narrow. That resulting into the movements of the vocal ligaments or vocal cords. So during inspiration, the vocal cords are slightly abducted in the intramembranous part, and they are adducted in the intracartilaginous part, and this is called pentagonal position. And second, during inspiration, the intramembranous part is diamond shaped, very large abducted, and during the high pitched voice in female and children, it is very close. The vocal cords are very close and linear shaped, and during whispering, there is more space between intracartilaginous part. Very good, girl. At present you are laughing, and during the exam the other will laugh. Right. So that is all about the larynx.